There are several ways that you can protect yourself from HIV, including using a condom every time you have vaginal, anal, or oral sex. More about this and choosing less risky sexual behaviors later. In some companies, PrEP is available. This is a course of HIV drugs which, if taken consistently as advised by your healthcare professional, prevents HIV infection through sex. Avoiding sharing needles, syringes, and other injecting equipment. Taking HIV treatment if you are a new or expectant mother living with HIV, as this will dramatically reduce the risk of passing HIV to your baby during pregnancy, childbirth, and breastfeeding. Asking your healthcare professional if the blood product you are receiving, blood transfusion, organs, or tissue transplants, have been tested for HIV. Taking precautions. If you are a healthcare worker, such as wearing protection like gloves and goggles, washing your hands after contact with blood and other bodily fluids, and safely disposing of sharp equipment. If you think that you have been exposed to HIV, you may be able to access PEP, a 4-week course or ARV drug taken after possible HIV exposure to prevent HIV infection. You must start PEP within 72 hours of possible exposure to be effective. Reduce your risk of HIV by getting a voluntary medical male circumcision. The relationship between your sexual behavior and HIV/AIDS. Important to note that medicine and research all teach the same conclusion about HIV and AIDS epidemic, and that is that HIV and AIDS is directly related to sexual behavior. Being a sexual being is an awesome thing, but like anything in life, it can pose some risk. Sexual health means having consenting, pleasurable, and safe sexual experiences. It's up to you to have sex in a way that reduces the chances of getting sexual transmitted infection or having an unplanned pregnancy. Remember, you are in charge of your body, your health, and your decisions about sex. Let us look at less risky sexual behaviors to prevent transmitting or contracting HIV. Abstinence, that is not having sex, is 100% effective way. Taking medicine to prevent or treat HIV, using male or female condoms, voluntary medical male circumcision, reducing your number of sexual partners, knowing your partner's sexual history, communicate and agree with your partner, being faithful to your partner. Voluntary medical male circumcision is listed as a method to reduce the risk of female to male HIV transmission. We know the procedure is done for hygiene and healthcare reasons or as part of religious or cultural traditions. In 2010, research showed that voluntary medical male circumcision can reduce the risk of female to male HIV transmission by up to 60%. This led the South African government to rapidly roll out a national VMMC program. In 2018, more than 572,000 circumcisions were performed, compared to 485,500 in 2015. Across the country, the VMMC program has mostly been well received, with 78% of women preferring their partner to be circumcised, according to the 2011 Youth Sex Survey. Time for reflection. Here are some questions to guide your thinking and planning. Name ways you can avoid contracting or transmitting HIV/AIDS. Give examples of behavior that carried a risk of contracting HIV/AIDS. Can you describe fears and common misunderstandings about the transmission of HIV? What advice will you give someone when asking you about voluntary medical male circumcision?